Hi, welcome to Healthy Kingston. My name is Janet Wade and I'll be your host today on what will be a pretty full and interesting and diverse program. We have several speakers today. First, we'll be getting the health agent report from Arthur Boyle as to what's been going on health-wise and what's been impacting the residents of our town health-wise. Then we'll have Bill Watson, who is a member of the Board of Health here in Kingston, who'll be talking about all we need to know about septic systems. And then her name is Jean Adams. She's a colleague and a friend of mine, and she is a cosmetics nurse, and she'll be talking to us about healthy skin care. And particularly with the weather getting warm and being outside more often, that's a pretty timely topic. And then lastly, I'll be following up with an update on measles, which has been turning into a public health crisis fortunately not in our town, but certainly there have been cases in Massachusetts and nationally, particularly in the New York area and in Washington State and in Oregon. So with all that said, I would like to first introduce you to Arthur Boyle, our town health agent, and have him give us an update on what's going on in his department. Arthur?
Well, I'm glad you started out with measles because we haven't had any reported cases and hope not to. It's mosquito season. Again, it seems like the first time we did this, it was the end of mosquito season.
You're right.
And
we've almost done it a whole year, Arthur.
Right. Hey, you've been a success. That and ticks have been a huge news item for both. And I heard somebody the other night use an expression, spray to play. It made a perfect sense to me. They said spray to play. If you're going to get out and play, you're going to get sprayed. And you've got two different sprays because you've got one for mosquitoes and one for ticks. And that leads me to another category. We've got the Plymouth County Mosquito Control folks who have just moved into a new facility in Plymouth. They were in Kingston for many years, and they're great people to work with. But they are starting to spray on June 1st, so by the time some people actually see this program, we'll be spraying with mosquito control. That doesn't do anything for the ticks. You've got to do that on your own because the state doesn't have a program yet, although we're all telling folks to contact their legislators because next year in the budget it would be a good thing to have a line for ticks as well.
Absolutely.
Because ticks don't know that the mosquitoes are being killed off and vice versa. They just know that they've got another food source and that's where they go for it.
Good information. Yeah. So really then two different sprays.
Right.
You need.
Right. And there are homes that you see when you're going up on the side roads off of the highway that you'll see please do not spray or no spray zone because they've got organic cranberries or organic tomatoes or whatever it happens to be.
Right.
So they push the don't spray us. So you've got neighbors who want to be sprayed and the neighbors who don't want to be sprayed.
Yeah.
And it's a delicate balancing act because again, in a slight wind, who's to tell where it's going to go?
Right.
But we haven't had any problems. And again, Plymouth County Mosquito Control has been wonderful to work with. I've worked with them before I came to Kingston, and I've worked with them for the past year, and they're great. They can't do enough for you.
Terrific. Well, that's good to know. They'll be in high demand this summer, that's for sure.
They will, and that brings us to beaches and pools.
Okay.
Okay. You've got to have a service like we do where they test the beaches 1 to 2 to 3 to 4 times a week, depending on weather for one, and depending on the heat. And you've got the petri dish and the indoor pools. You've got people say just shock it, and that's fine, but it doesn't always pan out the way you'd like it because there's kids in the pools and kids have accidents, and you've got to be on top of it all the time. And we're fortunate. We've got 4 or 5 public or semi-public pools in Kingston, and they're all pretty good people to take care of them. So that's not a health issue, thank goodness.
Mm-hmm. Oh, good. Well, that's good to know. And you said the beaches too? The
beaches, Gray's Beach in particular, that's become a real gem that in the town. They put a lot of money and a lot of work into it. And a lot of people. You can point to just about anybody in town hall who's had something good to do with the Gray's Beach. It's a marvelous situation where you took places that were summer cottages, made them year-round homes with a sewer system and all that, and the value of the properties have gone through the roof, which is good for some and not so good for others. But
Right.
it's it's a sign of good foresight, and the the former state reps and the former selectmen and the town administrators and folks like that have all worked pretty well hand in hand to get this done and to get a sewer system in that works. And people had their doubts initially. I know I was an outsider looking in at that time, and I marveled at the way they put it together. It really was well done.
Well, that's good to hear, particularly from you. That's wonderful. So any other updates, or that's pretty much what's on your plate these
That's all the
days?
news that's fit to print, is that what they say?
Something like that. Okay, great. And then we'll be hearing...
I've enjoyed this, by the way, to come down and, work with you.
This is your forum.
Yeah. Yeah, we encourage folks to call us if they have questions, because people are selling now, and, do you have to have a Title V under certain circumstances? There are some very, minute exceptions to having to have a Title V done. So you're probably going to have the test done, certainly. And then if there's, any faults, or you got a D box that's out of level or something like that, you'll have some small repairs. But you're better off, if you're going to sell, have it done first, because then you know what you're looking at. There's no surprise that comes up 2 weeks before the closing, and
Right.
you've got a septic system that needs work,
Working.
and these guys are all busy now at the time of year, and it's not a pleasant experience. And we've had people come in on several occasions that said, we didn't know we needed it, or
Yeah.
and one fellow who couldn't find his system, and the reason he couldn't find it was he's on the town sewer.
Oh.
So he didn't know he was connected.
Oh, that's funny. Yeah, no, that's good information to have, absolutely. Are you attached to it or not? But actually, I'm glad we had this time to talk about it. If any of you in our viewing audience have any topics that you would like to have discussed, we're trying to be as timely as possible and discuss things that are of interest to our audience. So if there are public health areas of concern for you, don't hesitate to get in touch with Arthur, and we'll be more than happy to address them on this program.
And I know you have Bill Watson coming in from the Board of Health later on.
Yes.
He is an expert on Title V, and is one of those, he's a go-to guy on the list that we make of people that know the
what's
things
going on.
things that come up. He's been at it 25 years or so, and he's a great resource. So I hope people will pay attention.
Pay attention to him. Well, I certainly will. So thank you,
Well, thank
Arthur,
you.
as always.
All right, it was a
Take
pleasure.
care.
Thanks.
Okay. Next, I'd like to introduce Bill Watson, who is a member of the Kingston Board of Health, and he's going to give us a lot of information on septic systems. So with that said, welcome, Bill. It's nice to have you here.
Thank you for having me.
Absolutely. So tell us who are minimally informed, what is a septic system and why do you use one?
All right, if you're a homeowner in the town of Kingston or the state of Massachusetts, if you're not currently tied into a municipal sewer system, you will have an on-site disposal system on your own property, which is called a septic system. The two basic components of a septic system are the holding tank, which is usually typically a 1,500-gallon holding tank, and the leaching field, or a soil absorption system, which, so the primary tank will hold just your solids, and will process the solids. It's like a digestive system unto itself. There's microbacteria that breaks down the solids in the liquid form, turns it into a liquid form, and then that comes out of the tank on an outlet side and goes out into a leaching field, which is typically trenches that have crushed stone built into them, and will be about 4 feet or more above groundwater,
Okay.
which allows the water to percolate through the sand and purify itself to go back into the groundwater system. As far as maintaining the septic system, it is recommended that the tank be pumped every 3 years.
Okay.
Unless you have higher usage in the house with a larger family, and it may be recommended that you do it every year.
What is the average? Is it like 4 people in a household?
Yes, yeah,
Okay.
typically a 3-bedroom house, 3 years is a good start.
Okay.
If you bought a house in recently or within the last 3 years or over 3 years ago. And if you haven't had it pumped yet, you should probably have it pumped.
Okay.
And when the pumper comes out, he will examine part of the tank and let you know if it needs to be done more frequently based on the last time that you had it done.
Okay. What can happen if they're not pumped? If they're not pumped every 3 years?
What happens is the primary tank will start to fill up with sludge and solids, and that may get put out into the leaching field. And then when it gets out into the leaching fields, it'll clog and block out the leaching field, and then it'll back up into the main tank and then back up into the house.
Oh, wow. Because I do know people have had that.
Yeah.
It's
And some of the signs of it failing could be out in the yard above the leaching field, where you might see wet water or water coming up, or you could smell sewage, and that indicates that the field out the leaching field is failing.
Are there certain things you should or shouldn't put in your tank?
Yeah, there's a lot of do's and don'ts, and we have a pamphlet that we're going to have at the Board of Health's office that has all that it has information in it. But yeah, I mean, typically you don't want to flush anything down that doesn't break down or is biodegradable.
Okay.
Sanitary napkins, cigarette butts, baby wipes, that stuff should not go down into the system.
Okay.
And if you can minimize the use of bleach and products like that,
Really?
because it'll kill the bacteria in the main tank.
Oh, good point.
And really, the main tank is basically a big digestive system.
Okay.
So,
Well, that's a good way to think of it.
yeah.
Yeah.
So if you have a system that you feel is failing, call a septic hauler, have them come down, pump the system, take a look at it for you. If you have a system in the town of Kingston, we have a loan program that if anything needs to be repaired or replaced, that we have a low interest loan of 2%. I think we still have $86,000 left in the account, and it's available for the homeowner to repair or replace the system. And it covers all the costs of doing that, from the engineering standpoint to the contractors that are doing the work, and any permit or fees that have to be paid.
How do you qualify for that?
There is no monetary qualification. You just have to be a resident of the town of Kingston.
Okay.
And contact the town of Kingston's office, and we'll put you in touch with our agent that handles the loan program. And I think that's the Old Colony Planning Council.
Okay.
We have.
Well, that's terrific to know.
Yeah.
Anything else we should know or keep in mind as far as septic systems go?
No, like I said, just periodically. I mean, you
Every
really have
3
to have it
years.
pumped every 3 years.
Yeah.
And it's so much cheaper to have it pumped than it is to have it replaced.
Oh, I imagine so. I imagine so.
It's
Much
probably
cheaper.
the second most expensive thing on your property besides your house.
Wow. And keep in mind what you put in it.
Exactly.
And you don't want anything
Yeah.
that's
Common
not
common sense
biodegradable.
rules.
Right.
Yeah.
Okay. Thank you so much. Good information.
Very
Appreciate
good.
it.
All right, thank you.
Now I'd like to introduce you to our special guest, Jean Adams. He's a cosmetic nurse with 14 years experience in the field. And being that this is the time of the year that we are all out now finally enjoying the sun, but with that a lot of skin exposure, we thought it would be a good idea to have a specialist come in and tell us a little bit more about how to better take care of our skin so that we can look great in the coming months. So, Jean, welcome.
Thank you. Thank you for having me.
What are some things you think we can all do to improve our skin?
Well, there are 3 things that everyone can do to improve their skin. The number one thing that everyone should be doing is wearing sunscreen every single day. Winter, fall, summer, year-round, with a minimum of an SPF 30, and also reapplying it. There are great sunscreens on the market right now. No longer do you have to wear the thick, goopy, kind of awful smelling sunscreen. They're very cosmetically elegant, and a lot of them come with tints here. I have a couple up here that are tinted. And the other thing is that you should be reapplying, which people don't do. And one of the things that you can do to reapply during the day is to use this, which is like a powder. So you can just put the powder on and
That's
do that a
terrific.
couple of
How
times.
often should one reapply?
They recommend every 2 to 3 hours.
Okay.
And also wear a broad brim hat. Baseball hats don't cut it because you have to think that a baseball cap is going to only be covering like the center of your face, not the outer parts. And people get lots of sun damage out here. And you want to protect yourself because, you know, we want to protect ourselves against skin cancer. We want to decrease our risks for that.
Right. And it's amazing how much sun I get just driving in the car.
People don't realize it. People say to me, well, why do I have to wear sunscreen every day? I work in an office. Where we get the damage is driving in our cars, walking to our cars, being in a window. So you really have to protect yourself year-round every single day, and you have to really incorporate that into your plan. And you have to do that with a sunscreen that you like, too.
Okay.
So,
and I remember you telling me this once, it's not only light-skinned people. I mean, people of color need to be applying sunscreen.
yes, everyone can get damage from the sun. So all races need to be using sunscreen every single day.
Okay. What else can we be doing to maintain our skin?
Using vitamin C. Vitamin C helps to protect your skin. It's an antioxidant, and it can protect yourself from all of the environmental things that, you know, are at us every day, and also a retinol. Retinol is one of the things that really can make your skin look bright. It can help to lighten up brown spots. It can do such a variety of things. It's a wonderful product to use. And there's one for everyone too. So there's over-the-counter, there's, you can get a prescription too.
Okay.
So I always tell people to get, you know, you might want to start with like an over-the-counter and build up and
Right.
then end up using a prescription. There's nothing like it. People spend hundreds of dollars on skincare, and you can really have a very simple regime with these three
What
things.
does the retinol actually do?
It helps to increase the cellular turnover rate of your skin.
Okay.
And there is study after study after study that shows that it really works. So you could go to like the makeup counter and spend hundreds of dollars for something, and they may have something with retinol in it, but this, you know, you really want like a pure retinol, and it really will help. You can tell somebody across the room if they've been using it because their skin is bright.
Wow. Now, and it's one of those things that takes a while. It doesn't happen overnight, does it?
No, it doesn't. I think you can usually tell like within about 6 weeks that you know that it's really starting to work. But you know, best results are like I think more like at 9 months, where you can really see like the brown spots will start to lighten up if they're caused from the sun.
Okay.
Because we can get different brown spots for different things.
Okay. So sunscreen, vitamin
C.
E, C, and then retinol.
Yes, those are the three.
Those are the three.
Yeah, the three
Okay.
big.
What is skincare different for men and women, or is it basically the same?
It's basically the same. Men should definitely be wearing sunscreen. I don't think they do as much as women, but they should. Men get a really good exfoliation every day from
Just by shaving.
shaving. So they're lucky they get less wrinkling in their lower face.
Yeah.
So no, basically the same.
Okay. Talking about exfoliation, how do you, like you have a beautiful glow to your skin. How can one get that healthy glow?
Well, of course, when you're using a Retin-A or retinol, you're going to get a nice glow to your skin. Another thing that you can do is make sure your skin is exfoliated. And you can do a little do-it-yourself at home with taking a little bit of your own cleanser and a little bit of sugar, just mixing it up in your hands and scrubbing your face with it. Be gentle. If you tend towards having like red on your face, you want to be super gentle with your skin with pretty much everything. And do that a couple of times a week.
Okay.
Also, medical grade peels can just help with that dead skin, take it off and give you, your skin will glow from that also.
Tell us about medical grade peels. What does that mean?
Well, a medical grade peel is something that you'd have done in a dermatologist office or with an esthetician, and they'd be stronger than you could get over the counter. And you do peel from peels. People are always surprised to hear that. So you really can peel. A lot of times peels are put on, and 2 or 3 days later you start to peel. And for a couple of days you'll really be peeling, and then your skin is left just glowing from that. The thing about using those is using your sunscreen faithfully and wearing a hat afterwards.
Yeah, because I imagine your skin's pretty vulnerable.
Yes, it is.
After that.
It is afterwards. Yes.
And what you said, and how often should you have those? You mentioned like 3 in a row.
Yep, you
Once
can
a
have
month.
3 of those in a row to start out every month. They're really good in the fall for most people, unless people are super vigilant in the sun in the summer.
What about sunscreens?
Well, everyone
and
likes to have like
bronzers?
like darker skin for the summertime. They want their legs to be kind of tanned, and the self-tanners aren't what they used to be. They are incredible now. One that I really love is this tanning towel from L'Oreal. Very simple, very easy, doesn't get on your sheets. The product is clear. Just kind of take it out and kind of put it on your body, and that you wake up in the morning and you're glowing.
Wow.
Yeah, they're incredible. They also have lotions that work well too, as long as you're like really rubbing them into your skin. And then there's also towels specifically for your face. This one is really good because it also exfoliates too. You don't have the orange that we think of years ago. So instead of tanning outside, really people should try these. They just work great.
And tell everybody about this. I love that.
Oh yeah, this is a sunscreen, moisturizer, an antioxidant, and one other thing. It's 5 different things. And so all you have to do is get up, wash your face in the morning, put this on. You've got your moisturizer on. You have your tinted sunscreen on, and it's doing great things for your skin.
Your retinol. You got it all.
No, yeah, no retinol in that one.
Oh, okay.
Yeah, but that's a great just to get up if you really want to be quick in the morning.
Yeah, for lazy people like me who don't
Yes.
want to go through all of this.
Yes, absolutely.
Anyway,
Yeah.
well, thank you so much, Jean. I really appreciate this. I certainly learned some things, and I'm sure our audience has as well.
Thank you
Thank
for
you.
having me.
Okay. And right now, I'm going to be giving you an update on the measles outbreak that's been happening locally and in this country. From January 1st to April 19th of this year, there have been 626 individual cases of measles that have been confirmed in 22 states, including Massachusetts. This is an increase of 71 cases from just 1 week. This is the second greatest number of cases reported in the United States since the year 2000. Back in 2014, there were actually 667 cases. But the way things are going, we will be surpassing the 2014 levels within the next few weeks. So what is the measles? It's a disease caused by a virus that spreads very easily from person to person. Measles look and feel like a cold or the flu. A cough, there's a high fever, runny nose, red watery eyes are all common symptoms. And a few days later, a red blotchy rash starts on your face and then spreads to the rest of your body. People ask, is it dangerous? Yes, it is. Measles often cause diarrhea, ear infections, and pneumonia. They can cause deafness, blindness, seizure disorders, and other brain diseases. However, those are a bit less common. Measles can also cause swelling of the brain and death, although, again, this is rare in the United States. Measles is most dangerous for children under the age of 5 and adults over 20 years of age, pregnant women, and people with weakened immune systems. Measles is spread more easily than almost any other diseases. The virus that causes measles lives in the nose and the throat, and it's sprayed into the air when an infected person sneezes, coughs, or talks. It can stay in the air for up to 2 hours. Other people nearby can then inhale the virus, and touching tissues or sharing a cup used by someone who's had the measles can also spread the virus. People with measles can spread the disease 4 days before the rash begins, and then up to 4 days after the onset of the rash. And the first symptoms I talked about, the runny nose and the fever, appear about 10 to 14 days after the person is exposed. Who gets the measles? Anyone can get the measles who's never been vaccinated. Babies younger than 12 months old because they're too young to be vaccinated. Adults who were vaccinated before 1968 because some of those early vaccines did not give lasting protection. And a very small percentage of vaccinated children and adults who may not have responded well to the vaccine. As far as how it's diagnosed, they can look at other diseases that cause a rash. The only sure way to know is if you get tested. Testing is usually done on a swab from the nose or the throat and on blood. The best way to prevent measles is to get vaccinated. Measles vaccine is usually given in a shot called the MMR, measles, mumps, and rubella. There are now many fewer cases of these three diseases because children typically get the MMR vaccine between the ages of 12 and 15 months old. And again, they get it right about the time they're going to enter kindergarten. According to the Center for Disease Control, 2 doses of the MMR vaccine are about 97% effective at preventing measles, and 1 dose is about 93% effective in not getting measles. State regulations require certain groups to be vaccinated against the measles, certainly healthcare workers, people working with children, 12th graders and college-age children need it before they go to college, and they typically have the 2 doses of the MMR before they enter school. Children in child daycare and preschool need at least 1 dose of MMR, and childcare workers also need to have 1 or 2 doses. A blood test or other laboratory results can provide evidence of immunity. So if you received the vaccine before 1968 and you're wondering if you still have immunity, you can have a blood test done to see if in fact you still do. And then if you don't, you would get another vaccination. Women who plan to have children and are not immune should get the MMR at least 4 weeks before getting pregnant. If you've been exposed to someone with measles, talk to your doctor or a nurse right away to see if you need the vaccination. If you get the vaccine within 3 days after being exposed, it will help protect you against the measles. People who cannot be vaccinated can be treated with immunoglobulin up to 6 days after exposure. And immunoglobulin may not prevent measles, but it does make the disease milder. People who have the measles should avoid all public activities until they are well again. And state regulations require anyone who catches the measles to be isolated for 4 days after the rash. That means they stay away from public places like daycare centers, school, and work.